Hello, my name is Bethany Golden, president of Over My Head Boutique. I'm here today to tell you a little bit of information about our cold cap therapy program through OhioHealth. Our program was originally discussed in April of 2017 and was patient initiated. A breast cancer patient and successful cold cap user approached OhioHealth about doing more to support cold cap patients throughout their chemotherapy treatment. A committee was formed, including clinical and non-clinical cancer service employees, myself from Over My Head Boutique, and a volunteer patient advocate. The committee spent a little over a year researching and developing a patient-centric cold cap therapy program available through Over My Head Boutique in the Bing Cancer Center. We have a exclusive partnership through Penguin Cold Caps available in England historically since 1988. We have a unique arrangement where their kits are available through Over My Head Boutique with all of the training, support, and accessories needed to have a successful cold cap therapy treatment through Over My Head Boutique and OhioHealth at the Bing Cancer Center. Additionally, we have a relationship with Capital City Dry Ice to provide all of the dry ice, creating a seamless and effective journey through your cold cap treatment. Through OhioHealth Foundation funds, we also have assistance available to pay for up to 75% of the cost affiliated with the cold cap therapy. Traditionally, the costs, including kit rental, dry ice, and all of the accessories, can be upwards of $2,500 for a chemotherapy treatment. With OhioHealth Foundation funds, we are able to assist in the majority of those costs through your treatment. We will send you an intake form from Penguin Cold Caps that will ask you questions such as hair type, hair thickness, down to what kind of deodorant that you use, and they will provide a personalized schedule of use that will tell you the timing and the temperatures that we must maintain during your chemotherapy treatments to successfully save as much hair as possible. This is individualized through those variables as well as your individual regimen for your chemotherapy. We will provide a set of 4 cold caps through Over My Head Boutique. We'll be changing these caps every 25 minutes, keeping them at the correct temperature per your individualized schedule of use. The caps will be stored in a cooler over dry ice. We will protect your ears and your hairline to avoid frostbite. I will show you a cold cap and how to put it on your patient's head. This is a cold cap filled with gel, and it will be frozen to the correct temperature. To ensure that it is the correct temperature, we will place a digital thermometer on the inside of the cap, folding it over, waiting about 30 to 45 seconds to make sure it is the right temperature, and then we will put the cold cap on the head. The front tab will cover the skin protection, and these 2 Velcro tabs will ensure a tight fit. Around the back, we will close the back around the nape of the neck using the 2 bottom corners of the Velcro to get that tight first. She has a small head, but everybody else's will be a little bit bigger than that. And then the top tabs will close, again ensuring a close, tight fit. Once that is done, we will close the chin strap. The chin strap should be tight, but should not be holding on the cold cap itself. This is a frozen band that will go around the hairline, attached in the front, going around the hairline, around the nape of the neck, around the other hairline, and pulled tight at the top and secured with the Velcro. We will have black Velcro straps that will additionally ensure a tight fit. I like to put the middle Velcro right in the center, covering these seams and pulled tight around the front. If needed, there is a second Velcro strap that can be put on the top and then pulled down, again ensuring a tight fit. On your treatment day, we will work individually with you to ensure the best way to get your kit to you. Prior to your alopecia-inducing regimen, you will need to pre-cool your scalp for 50 minutes. You will be changing the caps every 25 minutes during your chemotherapy. And then after your last alopecia-inducing chemotherapy regimen, you will continue cold capping for 3 to 6 hours, depending on your regimen. Packing the cooler and rotating the caps. The caps will be pre-cooled by Over My Head. The first 2 caps will be fresh out of a biomedical freezer, already at the right temperature. You will use the caps placed on the top of the cooler for the first 2 caps. Subsequent caps will be pulled from your pink bag that we also will provide for you. And during your first chemotherapy infusion, you will have an Over My Head staff member with you, training your support person and adding all necessary support for a successful cold cap therapy. Tips and troubleshooting. What happens if the caps are not cold enough? We will place a bag of dry ice on the gel side of the cold cap for an additional 5 minutes. This should take the temperature down where it needs to be. What happens when the caps are too cold? This is something that will happen more often than not. We will adjust our timing and take out the caps an additional 3 to 5 minutes before the change time. We will also massage the gel in the cap, creating a consistency in the gel around the cap and having it be the correct temperature. We will also flip your part in your hair from side to side in between the cap changes to avoid frostbite. These are some hair care guidelines that you will need to follow during your cold cap therapy treatment. No hair dryers, curling irons, or straightening irons, anything with heat during the duration of your chemotherapy. Additionally, no harsh chemicals such as relaxers, perms, or coloring during your treatment. Over My Head will work with you to determine when it is best to start coloring and using heat products following your chemotherapy treatment. You will also need to avoid hats, ponytails, and headbands, anything that will fit tight to the scalp. This will help ensure keeping as much hair as possible during your chemotherapy treatment. You will be limiting your hair washing to twice per week, 2 days before your chemotherapy treatment and 3 days following your chemotherapy treatment. Your hair will get used to limiting hair washing, so you don't need to worry about the oil that you might typically think will build up without washing your hair. We follow HIPAA guidelines. Your privacy is very important to us, and we are held to the highest standards. The next step is that Over My Head will send you an online intake form to be completed to determine your individualized schedule of use. Then, training and scheduling can take place for your first infusion. Cold cap therapy can be very successful when done accurately and efficiently. It does take a lot of time and effort, and one must be dedicated to its success. Thank you so much. If you have any additional questions, please reach out to myself, Bethany Golden, or any of our staff members at Over My Head Boutique. We are here to help you during your journey.